welcome to Tipsy Tooth Talk. I'm Dr. Carlin Palmer-Bloom.
And I'm Dr. Michelle Bishop, and I call it T-Cubed because I can't say it.
I mean, she's had a long time to practice since we've been MIA for, I don't know, since the summer, since I got back from Spain. We did the Spain one.
We did the Spain one, and then I went on my European vacation. It's like we took like a traditional European summer off. That's what we did.
Yeah.
We were just being truly European.
We practiced.
Yeah.
And she, went to London and Paris, and I moved.
Yes.
I moved, and my daughter started at UCLA. Yeah, we don't live on the same street anymore. It's been a thing.
It's like 20 minutes away, not like 20 seconds away.
It's been a problem.
Mm-hmm.
And my daughter started at UCLA. And
hi, Clara.
So in the last 2 months, I've been to LA 3 times, going Thursday. And
that's right.
So, and we've been to Vegas for Mommy Dennison Business, which I have a little clip to post from that.
Oh, awesome. It's been busy. Like, it wasn't like we were just like sitting around over the summer, sitting by the pool, drinking cocktails, twiddling our thumbs. Like, we have been on the go.
I have a pool for the first time in my life. I've always wanted a pool, and I'm renting a house right now that has one. And do you know, I haven't sat next to it yet. I haven't even put my toe in it yet.
I haven't been invited over for a drink next to it yet.
Because I'm still in boxes because I haven't been in town.
I have not been over there since the day she moved in. I'm just going to put that out there. Oh, well.
It's crazy. So you might notice we're in a different test kitchen.
Yes.
This belongs to our friend Jack Galbraith. So thanks to Jack for letting us borrow your kitchen
Thanks,
today.
Just Jack.
And some of you will know that reference.
Yes. Okay. I mean, you're going to have to bear with us. This is going to be, I feel like this is going to be a great blooper reel because we are so out of practice. I feel like we're going to screw something up along the way. Certainly, I'm not going to get words out, which I never do anyway, so it doesn't really matter. But
well, it's Halloween season. We should have started with, we're back.
Oh.
See?
Okay, see? We're not thinking things through right now. Okay, so what we're going to make today is an Aperol Spritz because that is the thing to drink when you're in Europe for the most part, unless you're, wine or Pim's Cup, or you're drinking sangria in Spain. But anyway, when I was in Paris, that was the evening drink. That was the evening cocktail happy hour drink. So it's a very simple recipe that you can easily recreate at home. 3 ingredients. Prosecco, our love, Aperol, and club soda, 3 ingredients. And it's really a 3-to-2-to-1 ratio. So you can't really mess it up.
I mean, I tried to a minute ago.
She tried to a minute ago. She
was like, I'm going to...
She was like, now am I pouring this in here? I was like, what were you going to do, eyeball it? She was like, oh, yeah. Right.
Yes, I was.
So 3 of those in each glass.
What?
Oh, it's going to bubble up.
See? Should have just eyeballed it. Done 2 of these and 1 of those, and then just topped it off.
Well, I mean, I'm good with that.
Down with that?
Yeah, I'm down with that.
Okay.
Let's go the other way. Okay, so now we're going to do 2. We're going to do 2 of Aperol.
Should we speak French? This is still no. I had to do this.
I feel like, yeah, duh. Speaking of duh, we're not really sure what that jigger is. If it's an ounce or what it is. We're assuming
it belongs to Just Jack.
We're assuming it's an ounce, and so that would go with our 3-to-2 ratio. But I guess as long as you're pouring the same, it should be fine.
Yeah,
it'll
the ratio will be right.
Yeah, it'll all be fine.
So at Signature, if any of you live in San Antonio, there's a restaurant called Signature that's delish.
Yes.
Up by La Cantera.
On the golf course.
Now they put something else in their Aperol Spritz. I think it might be like orange bitters or something, or they add something else. They add a flavor. And I don't remember what it is. We'll have to check it out next time we go.
We just can't sit in that back room again in the summer.
That back room is not climate controlled.
Friends at Signature, get some AC going in there.
Well, in the winter it's freezing. It's just that room is not climate
Okay, well
controlled.
then we never want reservation. Don't make a reservation and have it in the back room.
1, 2, 3.
I feel like it needs a little more.
Okay. 4.
Okay.
5. Okay. 1, 2, 3, 4, 5. There you go.
Look at you. Busting out with French and everything. I mean, the color looks right. Looks
Yeah.
good. Give it a little stirry stir. Color looks right. I can't even tell you how many of these I had in London and Paris. And then we're going to garnish with a little orange.
Yeah.
Grab your orange. I'm just going to drop it in there. I might grab another orange just because I really love orange. Oh, you're going to...
I'm gonna give
You're gonna
myself
squeeze
a
it?
little. Yeah, because I kind of like it. I like that little extra orange flavor.
Now I feel like, ooh, friend. She almost knocked my drink over.
Did.
That would have been
Fun.
a party foul. For sure. You know, we didn't even say what we were going to talk about dental wise. We were like, hey, we haven't been here.
Who cares?
Let's drink.
We'll get there. Cheers to beautiful smiles. These glasses are big.
They are big.
That's good.
It's perfect. Perfect for a summer. This is great by the pool, by the way.
You know, since it's Halloween and all.
Oh,
It's orange.
it's orange.
Hey,
There you go. Okay.
like my earrings. I think I wore these last year. They're my October. I wear them all the way through Dia de los Muertos every year.
Oh.
I love them.
I just have on my champagne ones that you
Your
gave me.
tipsy tooth
My
top
tipsy
ones?
tooth top ones. I didn't get the memo about dressing for
This is
Halloween.
just a thing I always do in October. So, aligners, right?
Okay, so today we're talking about orthodontic aligners. Aligners. So a lot of you will know it by a brand name, Invisalign. I just inhaled wrong.
And then there are some others that are, Invisalign's the one that made it famous.
Right, but they're all brand names, right? So everybody makes them. Different labs have, you know, different names for them, but they essentially all accomplish the same thing.
Like Kleenex.
Exactly. But
Nose
Kleenex
tissue.
has the brand on it, but everyone else has to call it facial tissue. Which, you know, the first time you order online from HEB, you realize, why am I not seeing puffs when I put in Kleenex? That's because Kleenex is a brand, not a type of... Anyway, I don't know who could have done that, but anyway, asking for a friend. So aligners, Invisalign is a brand of aligners. And so aligners have gained a lot of popularity. They are really good, I think, for people that have already been through braces and maybe need some minor alignment because they forgot to wear their retainers. Really trustworthy teens, and we'll get to that. People that just need minor movement, you know, maybe they have some crooked teeth or some crowding, but it's not major movement. And I'll come back to that as well. I mean, there are some amazing things that clear aligners can do these days. I don't do it as a general dentist.
I learned something from my orthodontist friend, Kevin Beischman, who used aligners to prevent having to do a surgical case.
That's awesome.
So he did it. So you see those people that bite down, we call it an anterior open bite. They bite, and it looks like their front teeth just don't go.
They don't touch.
Like how would they chew? How would they bite a piece of pizza?
They
right?
can't.
The front teeth
They
don't
have to
meet.
bite on the side.
In most cases, that would be a surgical situation. But this patient was like 60 years old, didn't want to have orthodontic surgery, but was having some choking issues or something like that, having some, you know, or maybe just didn't like her open bite, I'm not sure. But anyway, what he started doing and now is using on patients of all ages and things of that nature is you can intrude teeth with aligners.
Yep.
And what happens if you think of a hinge in an open bite, your hinge is getting wedged in the back. And so you can't overlap. And so what they do is intrude teeth to
Push
make
them up.
make
Push
them
them up.
make them, you know, shorter in your mouth, so to speak, to release that break in the hinge, so that you can close forward a little bit more. And so, so they are starting to use them in much bigger cases. You see the people with the little bumps, and she's going to go more into that, but I thought that was so cool, because you do kind of not consider the aligners when you're looking at a difficult case and you think, oh, this is going to be a surgical case. But now they're becoming so specific and so more useful in very specific situations. But just like she said, I would have an orthodontist do that. And we'll also talk about companies who let you mail order them and why we think that's a terrible idea.
Yes. Whew, okay, yeah, might have to take another step before we get to that one. So I'm going to give you an idea. So again, going back, aligners, great for lots of situations these days. The complex ones I leave to my orthodontist. So if someone comes into my office and, hey, you know, Dr. Bishop, I don't like the way the crowding is on my front teeth, I'm looking for very specific things for me to take that case on. Because I am not an orthodontist, and my patients know that. But I can do aligners, but I'm very, very picky about what I do, because I want to do very minor movement and leave the big guns to the big guys. So the first step for any patient would be, if your dentist provides aligners, whether that's Invisalign, I use Dandy, there's Clear Correct, there's Sure Smile, there's, again, all kinds of brands like Kleenex and Puffs, is to just have the consult done. And then what's usually involved is a scan of your teeth. If you remember a few episodes back, we had the scanner that I was showing you how I scan now instead of taking impressions. So we take a quick scan, we take some photos of your teeth, of your bite, of your profile. We take the x-ray that goes all the way around, that shows us the jaw, the roots, and everything. And all of that gets uploaded to the lab. And what it sends back to me is a computerized simulation of how your teeth are going to move. So I see you, I do all of that, I send that off to the lab, I'm going over the records, and then I have you come back in. And this is an extra step that I do that most orthodontists probably don't need to do, because this is what they do all day, every day, right? They look at something and they go, yep, I can move that. And but I want people to come back in, and I go through the steps on the computer screen, and we click through each month, and you can see how the teeth are slowly shifting each month, and then what the final result is going to be. And then I click at the beginning, so there's a side-by-side of before and after, so that we get an idea of what the final result, before we do anything, before we commit to anything, before we sign consents. That's just all part of my process. I want us all to be on the same page. And then if the patient is ready to go on that, we order them, and we get this nice little box full of aligners. And I will tell you that the interesting thing about aligners is there are a few cases where you can move the teeth without having to add what we call buttons. So when you think of traditional braces, you have the brackets, and that's what everyone, you know, doesn't want. But in aligners, most cases are going to need what are called buttons. And the buttons are tooth-colored filling material that are bonded to the front of your tooth in different positions. So those aligners, the clear plastic, can come in and put pressure to move those teeth. So orthodontics doesn't, the premise of orthodontics is that the wire and the brackets, we're putting force on the teeth to move those teeth into position. Well, the aligners have to do the same thing, and they do that through some clear buttons.
And if you think about it, I'm sorry, they're sticking out here. The whole thing of this is that these little aligners are changing their pressure points, right? So if you're pushing here and you're pushing here, you're going to rotate something. And to keep it locked in or to be able to pull it up or down, you've got to have something to grip on. So it's this thing that it kind of snaps over. Yes. But I mean, that's how they're doing it. And they make these little subsequent models. Now they do it on a computer. They used to do it like move the teeth on they had a cast, and they would like move the tooth a little bit and make a retainer, and move the tooth a little bit and make a retainer. And basically each retainer had a pressure point to guide that tooth to the new spot. and now they do that digitally.
Right. And so then the first appointment is adding the buttons, and I know you can't see this, and I won't pretend like you can, but the aligners come in, and this is our setup basically, and we have the patient in the chair, and we're putting the tooth colored filling material in the tray, fitting that into the mouth, setting that material on the teeth, and we also get very specific areas where they want us to place it. We have the guide for it. The other thing that a lot of times is necessary in aligners is what we call interproximal reduction, which is where we have to go in and create space in between the teeth. Old times, and still sometimes, very valid approach. Sometimes people would have to have some teeth removed. But with minor movement, sometimes we can go in with these they're little discs, I should have brought them. Little discs, and they come in all different sizes, and they're color coded.
They look like a little metal wheel.
Yes. Well, no, the ones I have are they're handheld.
Oh. Okay.
And they look like
like a little
sandpaper, like sandpaper or a little miniature saw.
Mm-hmm.
And it just slides in between the teeth, and they're all color coded to size. So, for instance, this case told me I needed to have 0.3 millimeters of reduction in between the teeth, and so I picked up the 0.3 millimeter reduction key, slid that through, took my measuring key that they send us, and I slide that through, and that tells me I have the appropriate amount of space. So, most people that are doing aligners for simple crowding, simple movement, it's about 8 to 10 months max. And then you end up in retainers afterwards, and just like regular braces, retainers are key. If you don't wear the retainers, things are going to shift. And you know, the success of aligners really is dependent on the patient. And this is where we're going to talk about a few things. So when we talk about people that have already been in braces, or mature teens, or anybody, it really all depends on you. You've got to wear these things 22 hours a day at least.
And I'll address that a little bit if you don't mind.
Yeah.
Well, so a few things. One is minor tooth movements, 8 to 10 months. If you're using these in place of traditional braces, they take as long as traditional braces. They only move your teeth. They actually move your teeth less quickly than brackets do, and so if you're doing a big case with them, it's still going to be an average orthodontic case across the board. Averages out 24 months. Right. I had them for 4 years. Some people have them for 8 months. You know, it's you have them for a while.
I have them for a long time.
But aligners on a full case are going to be a similar time frame. Right. My mom had them. Mm-hmm. She did it at the age of 60. I'll tell you why. Because my mom's front teeth, her upper front teeth were tilted in. We call that like retroclined. And so she kept breaking her teeth. Mm-hmm. She would know, she's her dentist. Mm-hmm. And I spent hours when I still lived in Corpus just making these beautiful lower front teeth that she broke. Yeah. And then I had to, we call it reduce the occlusion. Occlusion is your bite, when the way things hit when you bite down. I built them up, made them beautiful, and then spent an hour shaving them down because of her bite. I was like, look, I'm not doing this again until you get braces. And then she didn't get braces, and she needed them fixed again, and it was before she was in private practice, so I sent her to one of my friends, and she fixed them a few times, and she finally got her to do, she did Invisalign. She finally got her to do aligners at 60 years old, or 60 some years old, and I'm not gonna lie, she hated them. Mm-hmm. Now, she would have been a super rigid direction follower, like down to the teeth. And so for that reason, they worked. The dentist that did them for her started it on herself 3 times, and finally just went to an orthodontist and said, put brackets on my teeth because I won't rip them off, and I'm not wearing them. So you have to be somebody who's dedicated to the cause. I like them for teenage girls that are being super nitpicky about their smile because they're motivated. They're internally motivated, and they want something to be different. If you are not if you have the teenager that's like, I'm just getting braces because my mom wants me to,
don't spend your money on that.
No.
No.
I mean, just don't.
You'll lose your mind.
I used to work for the military. I was a Navy dentist, and I worked with another Navy dentist really hard with Invisalign to get to be allowed to do this, where they only had to pay the lab fee, because active duty military don't pay for their dental work when they're doing it on base, but we wanted to be able to provide that service, blah, blah, blah. Anyway, I mean, basically none of them actually wore it like they were supposed to. And so then you're a dissatisfied customer. So you have to be motivated, because everybody knows braces get uncomfortable. It's the tooth movement. They get uncomfortable. Do they hurt like crazy? No. But do they get uncomfortable? Yes. And you have to have the mental fortitude to not take it out when you can.
I will say that the majority of my patients are older and paying for it themselves, because usually after the age of 26, insurance doesn't cover it. So usually I find that my patients that are paying for it themselves in full are highly motivated.
Yeah.
But our teens, not so much. So just quickly going through some of the limitations of it, or some of the things to be cognizant of, is 22 hours a day. You take them out to eat, and I tell my patients take them out to drink unless you're drinking water, because these are sucked down onto your teeth. And what I tell them is the difference between this and braces is that if you're drinking a soda and that soda or juice or sports drink, whatever, seeps up under, and it will seep up into the aligner and it sits there all day, the decay
It's terrible.
is terrible.
It's terrible.
Along the gum line, because it just sits there.
It's as bad as it would be with traditional braces.
Yes,
That you don't brush right.
sometimes worse, I feel like, because they don't really think about it sitting there all day. You know, if you're in braces and you drink a soda, it swishes on by. This is actually trapping it along the teeth. So I tell my patients, take it out. If you're drinking coffee, if you're whatever, unless you're drinking water, take them out.
If you're like me and you would be drinking red wine, that's going to stain them.
Yes, that's going to stain them. And then suddenly your aligners are a funky shade of pink. And your buttons, remember we have tooth colored filling material on some of the teeth, and so then those buttons will stain too. But otherwise, I think the care is very easy. You take them out. This is the one time I don't care if people use toothpaste on it, on the plastic, because they're really only wearing them about on average every 2 weeks. I mean, so one package, we date them, and you put it, say today was your start day and it's a Monday, you would put them in today, and then in 2 weeks you would move on to the next package, and then in 2 weeks you'd move on to the next package. And I give my patients 6 weeks worth. So I'm gonna give them 3 packages, and then they're gonna come back in 6 weeks, because I wanna make sure that things are tracking. And by tracking, I mean things are aligning the way that I think they're supposed to be aligning, and if not, then I wanna step back. I always make sure that they put it back in the package it came out of. And I always ask them to bring in all their packages so that I can see that they have them. Because if they didn't wear one correctly, or they left one out for a couple of nights or something, we may have to step back to the previous one. So I always say, don't throw them away. Don't throw them away. The other big thing that I tell people, I give them a big bright hot pink or hot turquoise blue case, is to put them in that case when they're out eating, because you can see that they're clear and tiny, and you set that in a napkin at a restaurant and you get up and you walk away, or you throw it away. They're also your pet's new favorite chew toy.
Oh yes, just like when we talked about night guards and retainers and all those things.
Yes, pets love them because they smell like you. But overall, I feel like aligners have come such a long way. They're an amazing tool for us to correct some minor cases. In the orthodontist's hand, I think they have done some crazy amazing things that I'm highly jealous of, but I'm not going to do in my practice. So what I always try to tell my patients, even my older ones, and I can't tell you how many people over the age of 50 I have in aligners right now. Y'all are the ones that really want this. Is if you've ever thought about it, don't just disregard it because you think it's going to be too much, it's going to take too long. Go find out. Just go have the consult, and then sit through let me see the presentation. You sit through and you see how your teeth move, and you find out, gosh, it's only going to take 7 months to get there. I can suck it up for 7 months. go see your orthodontist and weigh the pros and cons of traditional braces versus aligners. That way you always make an informed decision.
Do not mail order them.
Yeah, okay, we gotta go
Do
there.
not.
Okay, we gotta go there. Hang
Do
on.
not. Do not. Do not, do not, do not. Do not mail order them. Don't.
And here's, just real quick, here's my reason why. We take x-rays of your teeth, and the way that teeth are supposed to move is that those roots, right? We have roots with our teeth, and sometimes when teeth are crooked, they're like this, or like they're turned like this, and so I can move the teeth without getting those roots straight, right? And I can line those teeth up, but if the roots are not straight and parallel, I know I'm in front of my face here, teeth are gonna shift again because the tooth moves with the root and it wants to be where that root alignment is. And so if you are taking your own impression at home, you know who you are, and somebody is simply just mailing these to you and you've got 10 of them and you're just gonna wear them, how do they know where your roots are? How did they even plan the case without having x-rays to know what they needed to move to get it in the best position for long-term success?
We've seen the root come out of the gums up here. They tell
I've seen that
the
too.
tooth back and the root coming out up here.
I've seen that too. I will honestly say I've seen some nice cases come out of it. But then I take a panoramic x-ray and I see that the roots are still a little jacky, and I'm like, you're gonna have to commit to wearing your retainers for the rest of your life, because I guarantee you if you stop, you're gonna go right back to where you were. So that's my biggest thing with it, is that you're doing your own dentistry, and you're risking so many complications. And for the money that you're spending, why would you do that to yourself?
And nobody's monitoring it.
Yeah.
So, you know, like she just told you, she has people come in every 6 weeks. And when I did it, I'm not doing aligners right now. I toss it around every now and then, but I'm not at the current moment. But I monitored every month. She's going every 6 weeks, which I think is perfectly appropriate. I was doing it back when it was earlier in the aligner world, and you know, and so I was doing it many years ago, and so I think that having somebody monitor and know that everything's going like it's supposed to go, and making sure you don't know if your impression was good in the first place. You don't even know if the case that you have is appropriate for your mouth because you've never taken an impression before. Right. There are so many things, and we've seen some absolute disasters, and here's what's going to happen, and has happened in my office. Somebody comes to me wanting me to adjust their aligner because things are going absolutely crazy. And it's unfortunate because we all know I work on kids. I always feel terrible when I have to say no to a kid because the kid actually didn't make the decision about their care, right? A kid that's in pain because their parent didn't do whatever. Any choice was not generally going to be the kid's choice, and I always have trouble saying no. But I'm not going to legally adopt a case that isn't mine. I'm not going to accept responsibility for that. And the bad thing about these online companies is you have no one to turn to when it's not going right, and who's accepting responsibility for that, and who can you turn to help you? You end up getting isolated and alienated if you need help, and you may not be the person that needs help, but if you are, it's terrifying. And so I just would never, ever, 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 ever recommend that.
No.
But
so, to wrap it all up, key takeaways: aligners, all different names. Invisalign started it. They're the godfather of it. Great product. But it has come leaps and bounds since it all started. Does some amazing things. Reach out to your dentist if you're interested in it, and see if it's something that's appropriate for you. And as always, if you have any questions, DM us and let us know. And
any topics you want us to cover?
Any cocktails you want to see? Look, hey, we made it through.
One
Welcome
of my
back.
high school friends sent us a cocktail to try. We'll have to look at
Oh, we
it.
gotta look at that.
Okay.
All right. Welcome back, y'all.
Cheers to
Cheers to
beautiful
beautiful
smiles.
smiles.